All right, I've got a motion and a second. All those in favor say aye. Aye. Opposed is nay. Thank you very much. We've got two ordinances on final read. Anybody on the council have any questions on these two items? If not, we can move into resolutions. All right, seeing nothing on these two, we have no ordinances first read. So, Madam Clerk, let's get down to 7A, resolutions, please.
A resolution authorizing the mayor to execute a declaration of restrictive covenants in substantially the form attached for 7 city-owned parcels located in floodway and identified as tax parcel number 117CA009 at 1134 Mountain Creek Road, tax parcel number 117PC006 at Norman Lane, tax parcel number 117PC027 at 108 Signal Hills Drive, tax parcel number 117PC028 at Signal Hills Drive, tax parcel number 117PC030 at Signal Hills Drive, tax parcel number 117PC032 at Norman Lane, and tax parcel number 1170 at 011.03 at 832 Mountain Creek Road.
All right, Councilman Henderson.
So I don't know if Ms. Williams is here or who could answer this, but I was just curious as to the reason behind the need to declare a restrictive covenant.
Thank you. This is actually being handled, it's on the ECD committee, but it's also in conjunction with Public Works. So Josh Rogers is here to help answer these questions.
So I'm Josh Rogers, work for Monier Minkara under Water Quality Program for Public Works. All of these parcels are within the Mountain Creek watershed, and we have been working in there for a Mountain Creek assessment and improvement plan, and one of the things that we looked at was floodplain. So any areas that are already in the floodplain that the city owned that property. And so these parcels are completely within the floodplain, most of them, actually within the floodway, and then the rest of them are in the 100-year floodplain or 500-year floodplain. So the majority of these are undevelopable to begin with, and so the city just wanted to go ahead we wanted to go ahead and put these in a conservation easement, but since we own them, we cannot put a conservation easement on ourselves. And so the instrument that we use is a restricted covenant agreement. And so by doing that, it just says these pieces of property are not going to be developed or changed. They're going to be left natural, and it leaves that area for the intended purpose of floodway for Mountain Creek, and also allows us to have these properties available for any type of greenway that might go in the future.
Okay, all right.
That makes sense.
Thank you.
All right, thank you. Madam Clerk, let's move on to B, please.
A resolution authorizing the mayor to enter into a lease agreement in substantially the form attached with Chattanooga Radio Control Club at 4246 Woodland Drive on a portion of tax parcel number 140133 for the lease of approximately 6 acres in a defined fly zone for the flying of model airplanes, club meetings, and other connected activities for a term of 3 years with the option to renew for an additional term of 1 year for the annual rent in the amount of $200 per year.
Good, Councilman. C, Madam Clerk.
A resolution authorizing the administrator of the Department of Economic and Community Development to enter into an agreement with Southeast Tennessee Development District for a 3-year period beginning on December 1, 2018 and ending on November 30, 2021, to, on behalf of the City of Chattanooga, apply for Environmental Protection Agency brownfield assessment and cleanup grants.
All right, seeing none, D, please.
A resolution authorizing Brightbridge, Inc., subrecipient on behalf of the City of Chattanooga to assign as Section 13-4A, assignability of the current subrecipient agreement between the City of Chattanooga and Brightbridge, Inc., the agreement to Southeast Tennessee Development District, subrecipient, and furthermore authorizing the administrator of the Department of Economic and Community Development to enter into a new agreement with SETDD in substantially the form attached for a 3-year period beginning on December 1, 2018, and ending on November 30, 2021, to, on behalf of the City of Chattanooga, administer the Housing and Urban Development Section 108 Guaranteed Loan Fund Program.
Any questions on that? Hey, Maura? Yes, sir. I know we discussed this briefly this morning. Would you just, for the council and those that may not be familiar with this HUD type of loan, do you have anybody that can just give us such a really quick brief so everybody
Yeah,
understands it?
sure do. Thank you. Sandra Gober is here from our Economic Community Development Office, and she'd be happy to give you more information about that Section 108 program.
Thank you.
Hello.
Good afternoon.
The Section 108 loan guarantee, this is a loan portfolio, and the capital for the loans is backed by the city's community development block grant. And the loans, the purpose of the loans is to create jobs, retain jobs for primarily low-mod income individuals. And we had, when we established the loan, it was through a contract, a subrecipient agreement with Brightbridge, and that subrecipient agreement is expiring, and we're entering into a subrecipient agreement with Southeast Tennessee Development District to continue managing that loan program.
All right. Still see no questions. Just wanted to make sure that we had clarification on that. Thank you so much. Madam Clerk, let's move on to, well, hold on just a moment. Councilman Gilbert.
Oh, that's all right. I'll ask her later on to get back up. Oh. What's the qualification again for the 108s loan?
These are really high-touch loans that are typically not bankable, and so the entity that's managing the loan portfolio process or the loan program is providing technical assistance. The subrecipient, Brightbridge, they did establish the range for the loans and the criteria with guidance and assistance and input from us. The primary principle behind the loan program is, again, to either assist a low-income individual to start a small business, or to assist a larger business in creating jobs that will be available to low-income individuals. And with Brightbridge, and I'm assuming the Southeast Tennessee Development District, they will establish the range, the size of the loans. Brightbridge, it was for $15,000 up to a maximum of $250,000.
Was there an interest rate on top of that? On the loans itself, is the interest rate? Is there
Excuse
different interest rates on the loans itself?
Oh, well, the interest rate, that is also set by the subrecipient, and with Brightbridge, it was around 6%.
Okay, it'll be the same way with the other company?
With the entity will no doubt sort of set that range with input from us, and it really will have to depend on what's going on in the market.
All right, thank you.
Mm-hmm.
Thank you. Good, Councilman. All right, Madam Clerk, let's move on, please.
A resolution authorizing the Deputy City Finance Officer to sign voucher requisitions and other necessary documents for and on behalf of the Finance Department effective as of October 1, 2018.
F, please.
A resolution amending Resolution Number 28367 entitled, "A Resolution Adopting the City of Chattanooga Employee Information Guide," and allowing changes to any and all information presented to City Council for approval within 6 months of the resolution effective date of September 8, 2015, 1 year from the effective date, and annually thereafter to reflect changes effective January 8, 2019.
I see no lights, but I do have a question. Beverly?
Yes,
Hey, how are you?
I'm doing wonderful.
So we received an update last week on the different changes to the egg. And I just want to clarify that the item that we are seeing this evening, all of the changes, no matter how slight they may be, to the egg were presented to the council last week.
No, that's not correct.
Okay.
So
What was
last
not?
week, yes, so last week, what was presented were those changes that had financial impact or also were significant policy changes. What you did not see is things like grammatical errors or
Okay.
if we reworded to clarify, a paragraph that was a little bit cloudy, we made clarity to those things, but not changing content. So those things like that, those minor things, was not presented to you.
Okay, so grammatically, but just cleaning up language are the only other changes other than what you presented. I know you presented the financial impact, but language that would, that we may be interested in that may affect employees one way, and I mean, are we shifting language that actually makes substantial changes with how we may deal with employees that we did not see, or are these pretty much related just to grammatical changes?
No, so not just to grammatical, so if I can elaborate.
Please.
In our, I'll say the current approved ag, there are several categories, I'll speak from these examples, let's say around the different types of leaves. The way that it was laid out in the current guide, you may have found 5 different places that spoke about leaves. So in this modified version, what we did was we grouped all like topics together so that it makes it more easy for an employee to understand what their options are instead of having to look 5 different places. So we made changes such as those. We also made changes where our policies may have been outdated and did not align with the law. So as an example, there were several areas where we had privacy issues, violations based on how the egg was written. So we made those changes to apply to HIPAA to protect employees' privacy in that regard. In addition, we made changes that would have impacted, let's say, FMLA processes. Basically, we wanted to make sure that we were aligning with all the laws and regulations, and we did the same thing in regards to any type of compensation issues that were out of alignment with the FSLA policies. Outside of that, other changes, there were title changes that were made in the ag, not necessarily to anyone other than the HR team. My team is growing and we're bringing on new individuals. And so as we have recently changed titles, we have made those changes in the ag as well.
Okay. I think that's, do you happen to have a red line copy of that?
I have a red line copy of, I guess, going back to 2015 of all the highlighted areas that needed to be addressed. We do have that copy. I do not have a copy of a red line version that would point to some of the items that I described. For instance, if I was grouping topics, we did not redline that and to bring it over, but in the one of the documents that I shared with you all that looks like a spreadsheet of the substantial changes from 2015 to 2018, it addresses those key topics. And if we replace the whole policy, we stated that as such. And also, if you all had previously approved policies that were not included in the ag, that's also outlined. So as an example, when the drug and alcohol policy was approved earlier this year, that policy is now updated in the ag as well.
Okay. Just for, I guess, future reference, would you mind sending around what you do have?
I'm sorry?
Would you mind sending around what you do have as far as the red line, the differences?
Yes.
Just for matter of record and being able to go back to review it.
Sure, I can definitely do that.
Okay, I'd appreciate it. I have one more question, but I'm going to go to Councilman Ledford first. Councilman?
Thank you, Mr. Chairman. That was actually my question about the red line copy, because I like to read what was and what is to be. Just kind of makes sense for me. And I think I had actually requested that early on in this process, and I did not see it. So I just let you know that I'm kind of still looking for that as well.
Okay, I can definitely provide that file. What I would share with you that would may be helpful to you, the document that I shared last week, which looks like the spreadsheet, if you would reference that document and perhaps go to the section of the red line, hopefully you'll be able to tie it together.
Okay.
But the red line version has all of the grammatical and everything else.
Sure.
Changes
sure,
in there as well,
understand.
so, yeah.
Yeah, thank you, Chairman. No.
Thank you. I think that's fine. Beverly, one other question. When you were working on the changes and the ones that are being presented to the council, did you work with the, with employee groups as well so that they are aware of what these changes are that are being presented and?
Well, I didn't personally. At the time that I was hired, the employee groups were already engaged. So various members of my team, members from around the city that were leading in employee groups, they worked with those various employees, collected their feedback, and so what we brought forth was the culmination of all of those things, yes.
All right, great. Thank you very much. I appreciate it.
Thank you.
All right, see no further lights. Madam Clerk, let's move on.
A resolution authorizing the appointment of Zlatko Kozlika as a special police officer unarmed for the Department of Economic and Community Development to do special duty as prescribed herein, subject to certain conditions.
Next, please.
A resolution authorizing the Director of Human Resources to execute a 2-year agreement with 3 one-year renewal options with On-Site RX, Inc. for on-site pharmacy services as outlined below for an estimated total amount not to exceed $1 million per year.
All right, see no questions. Oh, hold on just a moment. Councilman Mitchell.
Thank you, Mr. Chair. We deferred this last week and really didn't hear a reason why we were deferring, and now we're not deferring, and what's different from last week?
So the reason we asked for the deferral last week, there was some terms and condition updates that needed to be made to the agreement, and so I asked for the deferral to allow some additional time for the Office of our City Attorneys to look at that, and so those terms and conditions have been worked out, and we're ready to move forward.
Okay. Mr. Attorney?
Yes, sir. Ms. Malig has reviewed those and is ready to go. It's an $8 million deal. We wanted to make sure that we had reviewed all the provisions and had our standard terms and conditions.
Thank you. Thank you.
Okay, thank you.
All right, thank you. Good, Councilman. All right, seeing no further lights, those are all the items on our current agenda, but before we go to Public Works and Transportation Committee, we do have a departmental report from HR. Could have just kept you up here, I guess. Drug that out just long enough for you to sit down.
Well, good afternoon again. So this afternoon, we're going to give an update on our HR report, and what I'd like to do to get us started is to focus your attention that this report will be an update in regards to our safety, occupational health, and wellness programs, and 2 of my team leaders will be presenting their portions of this presentation, but I'm going to just level set in terms of how all of this ties in with our overall strategy. Next slide, please. I'm sorry, can I get some help with the presentation, please?
Are you sure it's on? Sometimes it flips off the side. Yeah, still not working.
No activity.
Can you move the slide forward from the back? All right, we'll go that route for now.
Thank you. So in July, when I met with y'all, I gave you an update in terms of the vision for human resources moving forward and what our strategy, which we are calling our people strategy, will be for the years to come. And so what I'd like to do is just refresh your minds around that. Again, our vision is building competitive advantage through people. One of the reasons why this is so important to the city of Chattanooga is over the next 5 years, we're going to experience some pretty large changes for local city government. We already know that there is a shortage for talent around the city and in other states, but for local government in particular, especially with us having a long tenured workforce, over the next 5 years and subsequent years thereafter, we will be losing about 20% of our workforce. In addition to that, when we think about the changes from a demographic standpoint relative to the aging workforce and all of the other, what I will call, environmental impacts that affect how any organization operates, this will be so important for us to be able to ensure that we have people ready, that they have the right skills, and can be able to deliver what we're needing for the city as well as our citizens. And so the strategy that we develop is focused on 9 goals, and they're under 4 themes. Next slide, please. The themes that we outlined were the area of recruitment and retention, talent management and development, reward and recognition, and a thriving and inclusive community. Our presentation today that focuses on the occupational safety and health will be targeted towards the area of the thriving and inclusive community. Next slide. So the goals under that there are 3 key goals. 1, we want to be able to create a supportive culture that is inclusive, positive, fair, where everyone has the opportunity to exceed. The piece that really stands out and ties into the safety and occupational health arena is where we're promoting an environment where health and well-being are actively promoted, where people feel engaged and valued for their contributions. And then, of course, we're always wanting to ensure that as a part of that inclusion, we're embedding a family-friendly approach. So when we speak about the thriving and inclusive community, that's all about the health and well-being, and it's not just the physical health, it also includes the spiritual and mental health as well. So what you'll hear from my colleagues, Mike Anthony and Starla Benjamin, would be their focus for this particular strategy. Next slide, please. So if you're asking yourself, so why is this important to the safety and occupational health arena? Well, there are 3 things that I'd like to capture for you. From the occupational safety and health actually affects our reputation here at the city, and it also impacts productivity. Think about this. None of us would like to be able to see any negative information about the city as we are trying to recruit and hire for talent. That's just not an area where someone would find that positive and want to come to work for us. And as a result of that, when those things happen, it could impact the number of applications that we receive for the openings that we have. In addition to that, there's a loss to the city due to work morale and employee retention. Think about this. When any of our friends or coworkers, when they get hurt, we hurt. And so oftentimes we think it's only the individual that has been hurt from a work-related injury or personal injury that's affected, but even those around them are affected as well. And then in the third arena, occupational safety creates opportunities, new opportunities for us. So when you think about this, instead of us, which we will share our numbers because we need our data analytics to make good decisions, but instead of us just focusing on the numbers and the past, we can't change that. But what we're wanting to do is to be able to generate ideas and get input from the employee base on how we can improve our safety and health environment here at the city. Any questions about the recap or in our focus?
Not yet.
Okay. All right. Well, I'm going to turn it over to Mike Anthony and Starla Benjamin.
Thank you, Beverly. Good afternoon. So in the past, traditionally, safety has been measured in sheer volume. We've looked at the number of injuries that are reported annually, and then from that we extract the number of OSHA recordable injuries. OSHA recordable injury is anything above and beyond first aid. So if you were to receive medicine, that's more than putting a Band-Aid on it. That makes it an OSHA recordable injury. And those metrics are very good internally for us to measure ourselves, to benchmark. But it doesn't allow us to compare ourselves to other entities, public, private, profit, nonprofit. So moving forward for FY19, we've changed our performance measure to an incident rate. That's a standard tool used in all organizations to measure safety. An incident rate is calculated with a simple equation. You take your number of OSHA recordable injuries, you multiply it by 200,000, and then you divide that by the number of full-time labor hours. Employee labor hours. So looking back at FY18, we had an incident rate of 7.3. So we set a metric or a goal that was realistic, that was attainable to reach incident rate of less than or equal to 7 for the FY19 year. At the end of the first quarter, we ended at a 6.9, so we know we're on the right path. From my analysis of the trends of injuries, we are trending down, and I'm forecasting that we will hit that goal, and then next year we can lower it even further. Next slide, please. So OSHA goes on a calendar year, whereas the city operates on a fiscal year. And this kind of gives you a good snapshot of both to give you an idea of what kind of injuries we accumulate through the years. It's broken down by department and by month. As expected, fire, police, and public works are our 3 largest departments. They do the 3 most dangerous jobs. They're going to have the largest number of injuries. Total injuries, they're on the right-hand column. But what I want you to take away from this really is that while metrics are important, data is certainly valuable to us. These aren't just numbers on the screen. These are people. Each one represents somebody that got hurt at work, coming to work to do their job. So, 96 firefighters that were injured and could not complete their job for that day, or possibly even longer. 105 police officers that were hurt in the line of duty. So as long as we keep that in the forefront of our mind, it helps us drive down those numbers because it's not just numbers, these are people. Next slide, please. And one of the ways we've seen our numbers decline is by offering more education programs to our employee base. And for our FY19, we've doubled the size of classes that we're offering in our catalog. Each class is offered twice a week for the entire month, every week for the entire month. And in addition to that, we will tailor it and bring it on site to a department, a division, a section, a team, or an individual if need be, so that everyone gets the education they need on how to be safe, how to identify hazards, how to avoid hazards, how to correct hazards. And my component in this is I'm looking at safety from a proactive standpoint. Starla, who you'll hear from in a minute, is looking at it from a reactive side. And together we're working in tandem to make the city of Chattanooga a more safe place. Any questions?
Councilman Mitchell?
Thank you, Mr. Chair. Can you go back one slide, please? Okay, so when you analyze this data, I'm looking specifically at Public Works.
Mm-hmm.
And of course, not quite a year yet, but you start the year at a certain level and the level's gone up quite a bit as far as injuries are concerned, because one injury is bad. Have you been able to get into the data with help and say, what's going on here?
We have. So if you plotted all those points on a chart, total injuries and also a line for OSHA recordables, historically our graph goes up and plateaus and it comes down year after year. It's been that way. It's a bell-shaped curve. This past year, we've seen a peak and then a valley, then a peak, and we're heading towards another valley, which indicates our frequency is going down.
Is that seasonal, though? I mean, is it?
Typically, it can be seasonal. November, December, we see less injuries. People want to be home for the holidays, the colder weather. They don't want to be outside as much. So it can be seasonal, yes. But we're also seeing that if you charted the OSHA recordable, there's a separation between those two lines, meaning our severity is also going down. We can attribute that to several things. One would be the education that we're offering. Two, we've implemented some different things. For example, we recently changed the lift requirements for an employee. We no longer allow an employee to lift anything more than 51 pounds. They can test it. If it seems heavy, get help, whether it be a hand truck, another person, a forklift. We've reduced lifting injuries considerably just from that. It's still too early to tell if that will be a long-term effect, but I believe it will. Just from the research I've done on the lifting injuries we've had, they've gone down in the areas of public works and mainly in public works. Although across the board, I would say the two categories that are most injuries are sprains and strains and slips, trips, and falls. But I believe that's because we have an aging workforce. which ties into Beverly's vision of we need to start planning for the future.
Thank you.
Good, sir. Councilman Ledford?
Thank you, Chairman. Almost the same question Councilman Mitchell had, but on top of the seasonal. Are any of these, the data shows any related to any specific, like, large projects?
Not necessarily large projects. We've seen some anomalies. Firefighters working a house that there's known asbestos. Well, then they fill out a first report of injury to protect them 20 or 30 years down the road, and that causes spikes in our numbers. Or fire or police working a scene where there's they come in contact with blood. It's not necessarily a true exposure, but we want them to be protected, and therefore we have them fill out a first report of injury.
Second part is the 51 pounds you mentioned, that doesn't apply to fire, does it?
No, so
They wear
emergency
more- they wear
situations
more
that
than
would not
that
apply
every
to them, correct.
Okay, thank you.
Yeah.
Thank you, Chairman.
All right, thank you, sir. Councilman Gilbert?
Real briefly, compared to last year to this year, on April and August and September, is the increase of incidents happening? 'Cause I know it's on here, April and August and September is kind of a higher numbers. Was it the same way last year?
I don't know. I can look into that.
I'm
for
curious
you.
about that, because if that is the case, or the year before, after that, then we might start looking at maybe pushing a little bit more on them particular months.
Absolutely. I will look into that, yeah. Thank
I
you.
appreciate it.
Mhm.
Councilman Ledford?
Chairman, thank you. Mr. Anthony. When I look at these numbers, are any of these numbers, do you track if these are first-time injuries or?
I do not.
Does that make sense,
Starla
the question?
may do you track that? We can track that, I believe.
We do track if,
We-
these are first-time injuries or?
We can track that, yes.
You can?
Do not, I mean, we do have quite a few that are.
Come on down.
We do have quite a few that are second-time injuries.
Second time.
Yes.
Okay.
Now, I will say, from my experience, April and the July, August, we have an increase of poison ivy, insect bites, those sort of things. This year, we had quite a few of poison ivy and insect bites. So where there'll be an injury, not necessarily is the treatment more than first aid.
So after a first-time injury is reported, is there a measure in place? Does the employee receive some sort of training or kind of asked to, let's avoid doing this again? What did we do wrong? I mean, accidents are accidents. I understand that's the nature of things. But in situations where, like, say, lifting something heavy, obviously, is there some sort of mechanism that kicks in place that says, hey, let's not do that again, or let's review what happened?
As a part of the, I'll say, incident or accident investigation, there is, so anytime that we know that there's opportunity to inform and improve on, or to prevent that from happening again, we do that. Now, a lot of our processes are not as formalized today, so Mike and team have been working very hard to formalize that. That includes our investigation process, but it's also more cascading to ensure that we're also educating, whether it's the supervisors, the employees, or anyone that comes in contact, so that we all know what to do and how do we coach and follow up for that root cause analysis to ensure the prevention.
So we try to learn from our mistakes.
Yes.
Very good. Short answer. Thank you very much. Chairman, thank you for indulging me.
Thank you, sir. Kind of beat me to my question. I should have waited to go to you. So in looking at some of the injuries and knowing that on occasion the council does have to deal with IOD claims, we have been asking for years, following up on those, have there been additional trainings put into place? Have the employees, and first of all, that goes back to assuming it's an avoidable injury. And in a lot of cases, it's just not, such as you said, the insect bites or an allergic reaction to something like that is not necessarily as avoidable as lifting something that's too heavy and thinking, oh, I can do it, and doing it and, injuring yourself as such. But are we seeing a high percentage of these actually being avoidable injuries, to where the classes that we saw that are given throughout the year can eventually, and as data comes in, can show that these classes are in fact reducing injuries in our employees by making sure they are educated or shown the proper ways to do things as we move along?
I believe that the training that we're doing is working, and I think after the 2019, if you ask me that question at the end of 2019 fiscal year, we will see a steady decline in a lot of these injuries that we're having. I have no statistics to give you right now to say this class has reduced this injury by this much, but I hope to have that in the future.
Okay, so by the end of 2019, we may just have more data just to at least be able to help shape what classes we're offering and ensure that what we're providing to the employees is what they truly need in order to be safer.
Correct. Correct, yeah.
Excellent. Okay, thank you. I see no further questions right now.
All right, so you can go 2 slides. So those numbers that Mike just presented to you, those are actual individuals with injuries. And those individuals have lives outside of their work. And so that's kind of what ARC Health and Wellness, that's kind of my mission, is to, when I leave work, or when I leave my house and my family leaves the house, I want everyone to return as we left. And so that's kind of my goal for city employees as well. Over the last year, we have paid out $2.9 million in workers' comp or IOD claims. That includes all of the medical, pharmaceutical, and settlements. But that $2.9 million is what the city has paid out. For the personal wellness of employees, that number, I'm sure, is a lot greater than that. So I try to work individually with departments and see what the needs are in each department and how we can build on that and how our department can support that. So with the fire department, over the last couple of years, we have worked on streamlining their physical screenings that we do annually. When we completed that, our next process was to look at the NFPA 1583, which is their physical fitness requirements. So we finished in 2017 with a more standard, what we wanted as a city or as the fire department to use. And in service, we had each firefighter came for one day to the Well Advantage Center. During that day, the first part of the morning was to do their physical fitness, and we focused on building exercises and stretching things that they could do in the fire hall that with equipment that they already had, and in hopes of reducing their injuries, the type of injuries that they see. So after that, then we focused on the nutrition part and what kind of macros, nutrients do they need, staying hydrated, what kind of supplements are out there, what supplements are good, what supplements are bad, not to get stuck in a fad diet kind of system. And then the last part was focused on mental health and introducing their peer support program that they now have in place. The local Tennessee chapter of the International Association of Firefighters worked really hard on lobbying to get more support for their behavioral health. And in July 1st, 2018, the Tennessee Public Safety Behavioral Act was passed, which required employers to offer 10 sessions of EAP instead of 6 or 8 that we had in place. So that was why we stuck the mental health portion in there, to go ahead and start talking about it and hopefully reduce some of that stigma. We also did the academy this year. They came through twice a week during their academy. We did exercises and stretches with those designed to increase job performance and reduce injuries. One thing I am proud of, that we had no cadets injured this year and having to leave the academy. So some of this is working. Next slide. So police department, when this law passed to allow firefighters and first responders for 10 EAP visits, we extended that to all sworn. So when we did this, I went out over September and October to talk about mental health and wellness and encouraging them to go get their mental health checkup once a year. I'm also working with them on their peer support team, along with FIRE, to help them build a program that's similar to what FIRE is using. Next slide. Public Works. Public Works also has a very physically demanding job. And one of our goals in OC Health and Wellness is to reduce barriers for individuals on their wellness goals. So working with Citywide Services management team, we were able to get all of Citywide Service employees down to the wellness center, do a facility orientation, go over the equipment, the services, the programs, the classes that we offer, got everybody's badge access, so we reduced that barrier. And we have seen a couple, an increase in some of those that now come into the facility. The next thing we did with Public Works was some stretching presentations. So during Public Works Week and a couple other times throughout the year, we've been down to Public Works and worked with them on their stretching, what they can do before their jobs and their task to hopefully reduce some of those injuries. Next slide. So mental health. I've kind of mentioned it twice already. It is a very hot topic nationwide. The generations coming up do not have the stigma around mental health that those in my generation do. And we're trying to break that stigma. It's not helped us to bury it, and we have a lot of employees suffering due to mental health and just trying to bury it. We've been doing some burnout sessions. I've had some administrators say, Starla, we've got some burnout in our departments. Can we do something? So we've had some presentations on that. We're looking at more ways that we can help in those aspects, as well as maybe adding a mental health provider or component to the wellness program. Next slide. So other initiatives we've done, group fitness classes. We average about 92 classes a month with an average, the highest class being lunch break fitness with about 11 average in that class. Health fair. We had a health fair this year in October, and this was the highest attended since we have opened the facility. So I was very proud of that. We've got challenges that go on for those that don't really like group fitness classes. We have challenges quarterly that we offer incentives to do. And these challenges are kind of your skill level to meet you where you are. We've had about 50 participants in each one of those challenges, and those represent 13 different departments, including retirees and dependents. We also have the mobile mammogram unit comes once a year, and we just introduced the mobile lung cancer screening this year. Weight Watchers is another popular program. Those members in Weight Watchers have lost about 500 pounds this year. And this is in addition to our dietitian that we have on staff. The other big initiative that we have that I think I'm glad that we have incorporated into the city is our personal return to work. In previous years, some departments would bring employees back to work, but as a majority, they had to sit at home with reduced pay or no pay. Now we are encouraging personal return to work, and I've been working with Public Works especially on each individual. Let's look at what their restrictions are and what kind of jobs can we get them back into so that we can get them back into the workforce. Any questions?
I've got one right now. Councilman Gilbert.
Necessarily a question for you, but I want to thank you for the mental health part. I think you're right. People in the generation in the past put a stigma behind it, but they don't understand that. I remember my brother telling me one time that to smell a burning body is the worst smell you could ever smell in your life. For firefighters to see that, and for them to see, and police to see kids pulled apart and things, adults, it takes a toll on you. So I really do appreciate that part of it. And the other thing was, I know we haven't had a measurement now, but hopefully in the future, the next 10 years, we supply the fire department with 2 uniforms. I'd like to know the effect of that versus past history versus as we go along, how to help them from not having side effects in the future. So I appreciate it.
Thank you.
Councilman Ledford.
Thank you, Chair. Get that button right. Thank you, Chairman. Couple quick questions. Diabetes is on the rise. Are we
is.
doing anything to address that?
We are. So kind of going into a teaser for your next week. I kind of left that out because I didn't want to spoil the next presentation. We're starting a diabetes education class in January. For those, and the only people that will be able to participate in this program will be those either with pre-diabetes or diabetes. It will be a 10 or 12-week intense program. We have a diabetes educator that's certified on-site that will be teaching these classes. We're looking forward to that pilot program. And I'm hoping that I can get the buy-in to allow employees to do this on the clock, to show an investment in our employees. And those that may not be able to have the time to meet after work or a lunch hour if they are a public works employee and they've got a route. So when is that good time for them?
Thank you. That's actually very exciting to hear, so I appreciate that. My second question is related to the wellness clinic. Do we know how many people on average are using it daily, that in the pharmacy?
Yes, we do.
Okay.
I don't have those numbers
That's okay.
in
You
front
can
of
get
me.
it to me.
And yes, I will.
I was just curious of the turnstile on that,
Yes.
on the building.
It is amazing.
It does seem amazing.
Yeah, and a lot of people don't see it because when they come in the building, it looks empty. I hear a lot of people say, well, it's empty, there's nobody here. Well, that's because we don't overbook appointments, so when you come in, you're not sitting in that lobby. And we're not booking 4 and 5 people to an hour. You have more time with your provider. Yes, so looks can be deceiving sometimes.
Understood. Thank you. Appreciate the question. Thank you, Chairman.
Sure. I don't see any lights at the moment, but I have a couple of questions. The Wellness Center is probably one of the greatest things the city has ever done for its employees, as a real investment in health for their employees, not just the clinic itself and not just the pharmacy, but also the classes, place to go work out, a kitchen to give classes on healthy eating and things of that nature. And part of the question was asked as far as usage. But in the facility itself, not just the clinic and the pharmacy, are we seeing a lot of employees taking advantage of going in and being able to use the facilities for working out, for that type of health benefit? Beyond, I think you said the classes you offer, you have an average of about 11 attendees. But what about just the casual walk-ins and usage of the facility?
I would like to see it higher. I believe we've had a downturn in some of that. I'm going to speculate just from hearing employees talk. One of the big complaints that I've heard was, well, we're not allowed to come down on our lunch hour anymore. Or we were taking too much time with the classes. So we kind of shortened our classes to 45 minutes, not an hour, so that insuring employees, you can come and go in your lunch hour. There for a while, when we had our highest participation, employees were able to come and work out on the clock. And just for their lunch hour and then eat at their desk, take a 30-minute break at their desk or whatever. So that has hurt us some. One thing, going back to what the fire department is doing, with going in on the 1583, one of their recommendations is that you allow the firefighter to work out 30 minutes a day on the clock. So that is something we didn't make mandatory this year, but I look that very well may be part of the case coming in the future years. I think it would be very nice to allow our employees to work out 30 minutes, go walk 30 minutes a day. Not only is that going to be healthy, it's going to help our mental health too, which I know that's not completely possible, but.
I don't think I could have had a better answer to my question, because that's exactly what I expected, which leads me to my next, which you somewhat already answered, and that is, what are we doing as a city to encourage employees to go and utilize facilities for their health? And I was going to ask about lunch. Some working out on duty. We've been talking about this in the fire department for a long time. So in order to back that up, based on what we saw for injuries, obviously we have 3 departments that you focused on here, which is where our highest level of injuries are. Are there a percentage of those injuries that you either know for sure or can speculate maybe would have been avoidable had our employees been more active in utilizing the wellness center? And although no injury can have a direct cost, especially as you pointed out, again, it's not just that person, it could be their colleagues, it's their families, it's everything. But are we talking about, you can't go down there at lunchtime anymore because you're 5 minutes late, yet, if you get an injury that you may have been preventable, it's much more costly to the city to make up for that. Are those types of numbers something that you're also looking at to present that as an option? It's hard to say, hey, let employees do this, but we can't tell you there's a cost benefit. So are you looking into that so that we can help promote that for our employees?
Yes, but it's hard to try to gather that data to say, a lot of our injuries, there's degenerative disc disease in there. Had we strengthened that core, maybe that person would not have been injured, or the injury would not have been as severe. It is an aging workforce, and we're not as active as we should be. And so it becomes very difficult in my job to try to say, is this from the injury or is this a pre-existing condition? Sure. Something that's on it. And I think if we can catch those and take care of those pre-existing conditions before they even become a work-related injury would be very beneficial.
Sure. And I know you can't know for sure, but the idea is, and there's a lot of businesses out there that are doing it. I know of a number of them locally that are purchasing gym memberships now as part of just being an employee at the company, and you're expected to use it a certain number of times a month.
Right.
But they're finding it to be way more cost effective to even pay that extra money per month, not having their own facility, and allowing employees to utilize that time. Both, and like you said, it's a mental health issue and it's also a physical issue, physical health issue.
And I'm looking forward to next year with the firefighters, since we are already encouraging that 30-minute workout, to see if those numbers do go down. Number one, the academy is getting special. We're working with them, and we didn't see any injuries. And then to work with, if each firefighter is working out 30 minutes a day, are we going to see a reduction in injuries?
Okay.
And I would just add, one of the ways, just as a reminder, Starla, today, we know that through lack of education relative to diabetes, we see a lot of employees that have come through that their diabetes condition has progressed because their lack of knowledge. And once they started attending classes or coming to or utilizing the facilities to get counseling and dietary help, then some of those things have been greatly impacted. So we know we have some data that shows that there is an impact. Moving forward, we do have a system now where we're collecting data. Historically, we've collected data perhaps sporadically, so some of the information for us to make good decisions off of, we would be speculating in that regard. But we have, but starting this year and moving forward, we have been building those systems and collecting that data, so we'll be able to see the correlation in the future for sure. But we do know that there are some conditions that have definitely been affected by someone's lack of not coming to the clinic or utilizing it.
Okay. Beverly, quick follow-up question for you. Is it an HR policy that prohibits employees from working out on their own personal time?
No.
I would like to know why employees are not allowed to work out on their own personal time.
I know that, well, depending on the group, and I will say non-exempt employees as an example. So when you think about some employees, based on them getting a 30-minute lunch break or whatever, those are like 2 15-minute breaks, or could be 2 15-minute breaks put together. So when they're paid or on the clock in that regard, I believe that that's some of the rationale. Now, it's definitely within our purview to be able to be more flexible and come up with ways to do that. But I think we need we need to customize that approach for each of the departments to ensure that they're still able to cover, but as well be able to allow employees to come and work out.
Absolutely, and I'd love to hear about a plan to be a little bit more flexible. At the same time, there's a personal responsibility for our employees not to take advantage of it and to be late or to leave early, but to just tell them no because maybe somebody was and somebody else that was following the rules, they were getting in and out in time. I don't find that to be even remotely fair to employees that may want to utilize the facility just because some people may not be following the rules. So I would, you don't have to answer now, but I would love to see something put into effect that does hold them accountable, but offer them the flexibility of their own personal time.
Okay, will do.
Okay, thank you. Starla, I have one more. I've got a couple of lights, but I have one more question for you. You mentioned IOD claims and $2.9 million that we've paid out. How many claims do we have pending right now that you're aware of?
So we have over 400 heart and lung claims or old injury on duty claims that were never settled out. Those are probably, I don't have those numbers in front of me, but that is included in that nearly 3 million are some of the old heart and lung claims.
Okay.
We have about 80 other open claims, ranging from probably 2015 to current.
Is there something preventing closing those claims out?
They're not at
more
MMI,
quickly?
not at maximum medical improvement. So it's either that person has had multiple surgeries, is not healing well, is a diabetic or a smoker who's going to take longer to heal. So it's just a matter of waiting to exhaust all medical treatment to get them to maximum medical improvement.
Okay, thank you. Let me move on to a couple lights. Thank you, Starla and Beverly.
And I want to add, Starla's been taking a really proactive approach in trying to work through those claims, but thinking about proactive for all of those, we've got to make sure that we're doing a lot of the proactive things to help bring closure to those. Starla's one person for the entire city, so it's going to take I'll say a village to help ensure that we're working the claims appropriately and that we're educating all involved about what are the right things to do in terms of whether it's the health and wellness or the re-education, whatever that may be. So it's going to take all of us really to pull that together. So,
Thank you. Councilman Ledford.
Thank you, Chairman. Clarification. Did I hear you say employees are not allowed to go to the wellness center on their lunch time?
These are some that I have heard, stories I have heard when we have asked, why aren't you showing up for class?
Second part, is this a citywide
I could
policy?
not tell you which departments they work in. So
Okay.
I don't know. Yeah, it's not a policy.
It's not
no.
a policy. It's not written down in our egg.
No.
Okay.
No.
Okay. So if I just want to grab some crackers and go down and do a few push-ups and squats and get back to work, that's not an issue? Or that is,
There's no
Taboo.
rule in the employee handbook against that.
That wouldn't be an issue, but one of the things that we'd have to do is this. I put the burden on both the employees as well as, I'll say, on management. So we need to make sure that we're providing a way to make that happen. And so that means that we've got to manage, I'll say, presenteeism better. So when we have employees that do want to go and work out, one, they've got to be proactive and at least acknowledging, I'd like to either extend my lunch or take my lunch to go work out. And so we've got to have a way to manage that. And of course, believe me, it's doable. We just, across the city, we just don't have one standard practice in terms of how to make that work right now.
okay. And the follow-up to that, and I apologize, but I got to know, if you hurt yourself, pull a muscle, while you're on your own time working out, how do we address that?
That is a personal.
That's a-
That is personal at that
That's a per-
point, yeah.
so-
That's part of that waiver you sign.
Okay.
For the gym, to work out. If you are working out on your own time, would be a personal injury.
Very good. I appreciate that. Thanks for the follow-up. Thank you, Chairman.
Sure. Councilman Gilbert.
Well, briefly, I know a lot of companies, private companies, are going towards smokers versus non-smokers, and what they're doing is giving a discount, about $600 discount to ones that don't smoke. Are we doing that? Is there a potential of doing that in the future?
I'm going to defer to my benefits person, but I believe we have a different rate for smokers. Is that correct, Madeline? Yes, so
Okay,
from a
thank you.
health and wellness benefit, yes.
I appreciate it.
You good, sir?
Yes.
One more question, Beverly. Sorry, having a hard time letting this one go. I would appreciate an email being sent around to all city staff, especially department heads, letting them know that they cannot prohibit employees, or that there is no policy prohibiting, not that they cannot, but there is no policy prohibiting employees from working out on their own time.
Okay. Well,
If I could just really
Sure,
quick.
Chief.
Yeah, those department heads work for the mayor. We'll have an internal conversation, and we'd like to report back to the council, because they do have
That-
the right to manage their staff.
Oh,
So we
absolutely.
understand, and we will look into it, and we hear your concerns, and we'll get back to you, but we need some time to have some conversation before we start communicating with department heads.
That'd be great.
Thank you.
So we'll communicate from here. We're just very concerned that people are being told that they can't do something that we just heard there's no policy for. So that was the question.
Okay.
Thank you.
All right, thank you.
I see no further questions. With that, we will move on to Public Works and Transportation Committee. Chairman Mitchell?
Can I have a motion for the minutes? All those in favor say aye. Aye. Thank you. Looks like, how you doing, Mr. Bailey? You're kind of taking the day off here, aren't you? Okay, let's see if we can get something for you. Okay, we're going to go to Public Works. Would you please read, I see I, but I don't see a number in front of it.
A resolution authorizing the approval of change order number 1 final for Tri-State Roofing Contractors of Chattanooga, Tennessee, relative to contract number Y17-0119-201, replacement roofing for Shepherd YFD Center Building for an increased amount of $18,546 for a revised contract amount not to exceed $173,615.
See no lights. Jay, please.
A resolution authorizing the approval of change order number 1 for Heflin and Cronenberg Architects, PLLC, relative to contract number Y15-008101, the Avondale Youth and Family Development Center for an increased amount of $164,798 for a revised contract amount of $505,298.
You want to wait till we read the next one and then get an explanation for both? All right, let's go to K.
A resolution authorizing the approval of change order number 1 for J&J Contractors, Inc., relative to contract number Y15008-201, the new Avondale Youth and Family Development Center, for an increased amount of $166,539 for a revised contract amount of $4,952,539, and to reestablish a contingency amount of $183,461.
Councilman Byrd. Thank you, Chair. I just want to know what are these increases and what's going on?
Good afternoon, Councilman.
Thank you.
Just to give you a quick overview or synopsis of what these change orders represent. One is for a landscaper that was hired by the contractor to do landscaping based on the Land Development Office requirements. Initially, we contracted with the developer to do the work, so they finally let the contract, and that's the additional amount. We had $10,000 there. It cost us an additional $4,500 for the landscaping. Another process was through zoning. We had to rezone because the facility is where it's located. So there was a fee for that, for the rezoning of the area for the center itself. Also, there was once the zoning and location was finalized, we looked at the parking lot and tennis courts and had to relocate them. That is, also for one of the public meetings, we had a company come in and do a 3D presentation for the public meeting. Not sure if you were there or not.
I did a 3D.
Yes, a presentation like a virtual.
Okay.
And then also, as we looked at the things we would like to have inside the facility, IT came in along with the library and said, we need additional drops and electrical outlets and things like that within this facility. Although EPB was with us in the design process, they finally came back and said, based on the load that would be required for the facility, they wanted to put a transformer on the ground versus on a pole. So that was something that came from EPB. And with the changes and some of the other things that are being asked, our construction time has been stretched from 8 months out to 12 months now. So there's a fee associated with that.
From 8 months as well. Can I please get, I'm still, after you explained the things that were going on, I'm still kind of in the air about what's going on. You know, it's still with the change orders and the things that went up. So could you send me something in writing, some type of, so I can explain to my constituents? I have several people, especially even here in the audience, that will be concerned about the fees that are going to be associated with these two line items. But, and I definitely want to be able to explain it to them. And then I do not see associated with this anything that had to do with the changing of the bleachers or the changing of the basketball court in the facility. Did that have anything to do with this? Do you know of that? Was that a part of any of this?
None of the change orders that we have here, sir, no.
Nothing had anything to do. Do we have any, Stacy, do we have anything concerning those?
Hey, Councilman. So a couple things. We have been looking into a lot of options. I know Public Works has been looking into options for the for adding some material both to the front of the bleachers and to the top of the bleachers to increase the comfort of folks who are there watching games and to improve the perception of safety. Excuse me. They've also been looking at options to shift the actual field of play for the court to increase the buffer zone. There are engineering and architectural considerations that have to be made whenever we look into that. And so we were hoping to be able to report those to you today in conjunction with this change order, although they are separate. The work for this change order has already happened.
Gotcha.
So it's different things with the site that have already been completed. And so what we're talking about would be additional change orders and
Okay.
additional changes in scopes. But we had hoped to be able to give you all the information at once, but unfortunately, we just weren't able to get that together. We'd be happy to make a commitment to come back to you within 30 days and talk about those options, maybe with your community members present. Obviously, we know that's important to you, before we make any final decisions about what those considerations need to be.
Okay, can I don't, may I ask another question, please?
Sure.
Okay, I have one of the neighborhood association presidents here. Have you met with you all have a committee? I know you, Gerald Perry, Super T, and some other people were getting together to form a committee to get updates and outcomes on what's going on. Have y'all had a first meeting yet on that? Have y'all had any updates? Not yet. So can, Coach, if he's here too, can we make that one of the, I guess that could be the first in 30 days? That will be our first update and input committee meeting with the constituent as well. I think that will help out a lot in moving this forward and setting a time to say, hey, well, every 30 days, so we'll say we'll give an update every 2 months on where we're at with the project.
Yeah, absolutely. And I think we want to just make sure when we come to that committee meeting, we have budget numbers and samples and all the information so that we're being as transparent as we possibly can. So we look forward to doing that so that we can come up with a solution that makes sense for the community.
Thank you. Got that, Kim? All right. All right, thank you, Stacy, so much. Okay, and so you said instead of 8 months, the project is pushed 12 months back now to where, so we're looking for a completion time or this is for phase 1, correct? That we're pushed 12 months out?
No?
Okay, go ahead.
Yeah, that's total.
I only know because we went over this extensively today to try to get you as much information as we could. Our original goal was to have this so that summer programming could be happening in the facility. So we wanted it done by the time school lets out.
Wow.
Now, if we make additional changes to the structured engineering, architecture, design, whatever, we'll have to take timeline into consideration, so we want to do that with the community. So
Okay.
we don't really know exactly how those changes would influence our timeline. So at this point, we don't want to be giving information that may change based on later decisions. So if we could give a full timeline update once we've made those changes or decisions about materials for the bleachers or the court or whatever, that's when we'll have an idea of real timeline, if that makes sense.
That makes sense. It makes sense. One more question that the community. I thought I saw Coach Jennings here. He left.
Maybe
Okay.
the restroom.
I don't know more. Probably it's a question for you. Maybe not Stacy. Do we have a incidental? I see where HR presented the incidental report from where employees have gotten hurt on the job, and they have the little timeline from January for the year. Do we have any type of incidental reports that come from our YFD center where kids or adults or someone that's gotten hurt outside of the employees? Because I do get a lot of phone calls, and I don't know if it's the perception or the reality that people get hurt at the YFD center more than it's said. I'm not sure if that's true or not, but I would like to see something if you can get that from Coach, just to say, hey, here is what has happened in the year of incidentals or things that have happened at the centers, different, not just Avondale, but Carver,
Yeah, let me talk to Coach about getting that. I haven't seen that, a report that looks like that, but
Yes, ma'am.
I'll find out if we've got it.
All right, thank you.
Yep.
Got it? Councilman Henderson.
Mr. Stone, what month are we in construction? We were hoping to be done in 8 months. What month are we in?
I'm gonna have Dennis Malone come up and give us a.
I was wondering
update
when
on
he
it.
was coming up.
Good afternoon, council.
Good afternoon.
I think some of this was the original contract with the consultant was for an 8-month construction period. As we went through the design of the building, the project was realized to be more of a 12-month period. So we moved it from a 8-month contract with the contractor to a 12-month. So part of what was being talked about was the consultant's time changed by 4 months. So that was additional time that they have to do construction admin services above and beyond that. Now, there is some time changes that took place from what the original construction was to some issues that we had in our land development office in meeting the new requirements to be able to get the whole site permitted. That delayed the contractor for about 40 days. If you look through the backup information for the CRF, you'll see a 40-day extension in time. That is what has got us out to the end of April, the 1st of May timeframe right now is where that kind of sits. Right now we have got a roof going on the roof, on the gym itself. They are prepping the floor area of the gymnasium to begin pouring the concrete portion of the floor here in the next week or two, depending on what weather allows them to do. And then they're continuing to work on the masonry throughout the project, continuing to put roofs on. And then once all of that gets dried in, they'll be moving into the other disciplines such as the electrical and final surfaces as we continue to move towards that end date.
So I'm not sure I heard an answer to my question.
Okay?
What month are we in construction? 1, 2, 3, I don't remember when we started.
I'm thinking, when did we start?
Does anybody know the answer to that?
We started in January, and then if you add that 40 days, that gets us to a 40 days later. So that set the end date back 40 more days. So the end date originally was going to be in January. Then now it's been moved back into March based on that 40-day time extension because of the LDO requirements. And then there's been some rain days for weather that's been allowed based on the contractual items that deal with weather. So right now, well, I would say we're in month 10.
So you're anticipating more than a 12-month?
Yes, because we already extended it 40 days by the CRF. So we were already expecting that 40 days. So instead of a 12-month, it is a little over 13. And then whatever rain days have been approved has increased that as well. I'm not exactly sure what that total time is, but we're looking right now as the completion date at the end of April of next year.
All right, so the two resolutions, one's for the architect, one's for the actual contractor.
Correct.
Is the contractor in charge of the consultants?
They are not. The consultants were hired by the city, are under contract to the city.
So the consultants have nothing to do with this increased amount of $166,000?
The $166,000 on the contractor's change order, I believe, or is that the 160?
The 166 is part of the
consultants.
Contractors.
Okay, the contractors. I mean, you can look in the backup. I think the biggest part of that was when we got to site and started to work, we had some bad material out there that had to be undercut. We had an estimate for what that would be. It exceeded that estimate to the point that it was $106,000, which took $106,000 of our contingency, which we only funded at about 5% of the construction cost. And there's been a few other changes here and there that have moved that number from 106 to 66, about, what's that, 60 more thousand of changes here and there for things that have caused it to go up. I'd have to look at all of the backup to see exactly what each of those are. Some of them have to do with electrical, as Mr. Donald just spoke about. Originally, we were told that we would be able to get power on one side, which was the side there at Wilcox. And so our designers designed it that way. And then when we got ready to go to construction, EPB came back and said, whoa, we can't provide that type of power from this direction. We got to come from another direction. Forced our consultant to go back and do some redesign because it was coming from another, from the other side, from the south side, across the site to reach them, which also changed things up with our contractor because the design changed, so there was increases there. And then, there's other things as the project goes along where little things have to be changed or added just because something unknown reason or just from the job site.
So the majority of the 166,000 was because we had some bad soil out there that we had to get rid of.
That was the majority of it, yes, sir.
And then did that relate to the 164,000 that the architect charged?
Some of that is, some of it was the redesign for the electrical service and it come in. There was other additional things. We needed them to also design for us the electrical for the parking lot, which wasn't part of their original scope of their work. As Mr. Stone also said, originally it wasn't considered that we were going to have to go in and have the, excuse me, I'm thinking here. The one thing we didn't realize that we were going to have to, trying to think of what the right word was. Yeah, I got the other was the. It was the portion that was part of the consultant's contract to do the work that we needed to do to get it rezoned. And that also included replatting. There were some easements and some other things that had not been cleaned up from the past. We had to go in and get a consultant to come in to do that work underneath their contract to help clean those things up so that we could get the project replatted and rezoned.
So we're going to see an increase in contract for the consultant at
Yes.
some point?
No,
No?
the consultant's increase is in front of you. It is the first one.
So you're saying the architect is the consultant?
Yes, sir.
Okay. All right. Thank you.
Councilman Byrd.
Thank you, Chair. At some point in time, I need to sit down and talk with you and get a better understanding of the report that you just gave us, because a lot of times this is a very passionate project, especially for this community. It means a lot. And when they're talking to me or asking me questions, I don't want to shoot from the hip, so to say, and give them information. I want to be able to show it to them. If it's possible, I would definitely love to sit down in the near future to talk with you and get some stuff on paper to see where these expenditures and money is coming from and where is it going, so that we can so I can elaborate it to them as best as possible.
Okay. Yeah, we can
Okay.
work something out.
I would love that. Thank you.
You all right?
The second phase, or I think it's 2 phases or 3 phases to this, will we be right now looking at the stage that we are now? Is it safe to say that we're going to be able to finish this project and we are within the range that we allocated for it? Or is it safe to say that we're going to need extra financing to make this project as grand and as amazing as we would love for it to be?
We are completing the design for the Phase 2, which is the site work for the project, which includes the demolition of the existing facility. It includes the parking lots that are necessary. It includes a multi-purpose field. It includes a outdoor basketball court, and some other items that are part of that. We are looking to be complete with the design part next week, and then we're going to go back and relook at what the cost estimate is for that. We've got some funds available that were set aside. There was $800,000 set aside through a water quality funds in a previous fiscal year.
Right.
There are some other funds still left from the 6.2 that's part of this project. Then there are some other dollars that have been talked about of how to cover some of that cost. So that's a discussion that we're looking at having internally over the next couple of weeks to see where we are and to see if there needs to be an ask for funds to move forward, or what that scope ends up actually looking like.
Okay, I would love to be a part of that internal conversation.
Once we are able to go through and vet all that internally, then we will pass the information along.
I look forward to it. Thank you, sir.
Okay?
You okay? Councilman Gilbert?
Dennis, you said multi-purpose field. What kind of multi-purpose field? Being for football, soccer, or what?
It's one of the desires that YFD had was to put down a multi-purpose field that was not grass, but it is a synthetic turf. And so that was a portion that we've designed into the next, to that portion of that contract to be used for for football, for soccer, for whatever purposes that may be the season for use.
Are you still gonna have the 3 baseball fields? I think it's 3 or 4.
There will still be, there will be 2 fields.
2 fields?
There'll be a baseball field and a softball field. The other field is basically where the YFD Center is sitting there at the corner now.
Okay, thanks.
You got it? I don't see any other lights, but I have a question. Did I hear you say, and I could have been mistaken, did I hear you say you started construction before you had a landscaping permit?
Started construction before we had a landscaping permit.
40 days. What's that about?
About that time, there was some changes that took place in the water quality that we were somewhat caught in between. And we had some design things that we had to do to catch up to being able to move forward towards a full a full permit to go to construction. We had a land disturbing permit.
Stormwater permit,
Yes,
not a landscaping permit.
but correct. It's part of the water quality.
Right, we're dealing with
Permit.
that quite a bit these days. Okay, and so that's how you're going to access water quality money because of what?
The water quality money is to do drainage for the site.
Okay. All right. I don't see any more lights. I don't know, we might be done. Looks like L. How about L?
A resolution authorizing the city finance officer to execute any and all documents necessarily related to a loan agreement with the Tennessee Department of Environment and Conservation, CW 72019-428, for financing of capital construction projects required by the consent decree for the Interceptor sewer system for a total project cost in the amount of $3 million.
No lights. M, please.
A resolution authorizing the city finance officer to execute any and all documents necessary related to a loan agreement with the Tennessee Department of Environment and Conservation, SRF 2019-429, for financing of capital construction projects required by the consent decree for the Interceptor sewer system for a total project cost in the amount of $21 million.
Well, we're on a roll. So we'll go to next week. You really want to do this?
Mr. Chair, the department would like to humbly request that we defer this. Staff is out of the office today. So we're not prepared to discuss this today.
What does the council think? You got it, buddy.
Thank you.
Does that do it? Any more questions? Any more? I don't see anything else. Anybody got anything? Mr. Chair, do we have any more? No, sir. We're done. Well, we're adjourned till 6 o'clock then. Thanks, Donald.
Thank you.